public healthcare to terminate humanity by COVID-19 pandemic. More on this by Dr. David Martin. Is their intention to terminate humanity by public healthcare? The next video is part of the opening presentation to the European Parliament International COVID Summit 3 in Brussels on 3 May this year by Dr. David Martin on the origins of COVID in 1965 and COVID vaccines in 1990 that clearly mention that the public healthcare is weaponized against humanity with intention of extinction level event. Have a look.
In 2005, this particular pathogen was specifically labeled as a bioterrorism and bioweapon platform technology. Described as such, that's not my terminology that I'm applying to it. It was actually described as a bioweapons platform technology in 2005. And from 2005 onwards, it was actually a biowarfare enabling agent, its official classification from 2005 forward. I don't know if that sounds like public health to you. Does it? Biological warfare enabling technology. That feels like not public health. That feels like not medicine. That feels like a weapon designed to take out humanity. That's what it feels like. And it feels like that because that's exactly what it is. We have been lured into believing that EcoHealth Alliance and DARPA and all of these organizations are what we should be pointing to, but we've been specifically requested to ignore the facts that over $10 billion have been funneled through black operations through the check of Anthony Fauci and a side-by-side ledger where NIAID has a balance sheet and next to it is a biodefense balance sheet equivalent dollar-for-dollar matching that no one in the media talks about. And it's been going on since 2005. Our gain-of-function moratorium, the moratorium that was supposed to freeze any efforts to do gain-of-function research. Conveniently, in the fall of 2014, the University of North Carolina, Chapel Hill received a letter from NIAID saying that while the gain-of-function moratorium on coronavirus in vivo should be suspended, because their grants had already been funded, they received an exemption. Did you hear what I just said? A biological weapons lab facility at the University of North Carolina, Chapel Hill, received an exemption from the gain-of-function moratorium so that by 2016 we could publish the journal article that said SARS coronavirus is poised for human emergence in 2016. And what, you might ask, Dave, was the coronavirus poised for human emergence? It was WIV1, Wuhan Institute of Virology Virus 1. Poised for human emergence in 2016 at the proceedings of the National Academy of Sciences, such that by the time we get to 2017 and 2018, the following phrase entered into common parlance among the community. There is going to be an accidental or intentional release of a respiratory pathogen. The operative word, obviously, in that phrase, the word release. Does that sound like leak? Does that sound like a bat and a pangolin went into a bar in the Wuhan market and hung out and had sex and lo and behold, we got SARS-CoV-2? No. Accidental or intentional release of a respiratory pathogen was the terminology used, and 4 times in April of 2019, 7 months before the allegation of patient number 1, 4 patent applications of Moderna were modified to include the term accidental or intentional release of a respiratory pathogen as the justification for making a vaccine for a thing that did not exist.